Need to move along to our Q&A panel. We have some time for that, so I'd like to ask our presenters, Dr. McWay, Dr. Swamy, Dr. Cadotte, and Dr. Nichols to please come and join me here on the stage. And remember, they are happy to answer your questions, but they cannot offer any specific medical advice. So come on up, grab a chair, and if you have a question, please put up your hand and a volunteer will come to you with the microphone. And one question per person, please. And for those of you who are joining us virtually, a volunteer in the audience will also relay your questions as well. So just type them in and then they will be relayed, and then hopefully we can get to those as well. So I will now move along here and we can, where is the microphone? Oh, Sandra, do you have the microphone or? Up at the back. Okay, so the microphones are at the back, and how am I walking? Okay. I have to really think about it. I was hoping you'd give me that one, but you see, I need to move, even though of this wonky hip. Okay, so do we have any questions from our audience here? And we have a couple microphones that I think we'll take one right here in the front. Microphone is coming. And to any of our experts, fire away. McWay. Well, it's interesting. I can hear you, but I don't know if at the back can hear you. Oh, there it is. Maybe you might have to just really.
I'm just wondering with your physical condition, I'm just looking at your bike, and I'm just wondering how you get onto it and you're able to balance yourself as you're starting, or if that's something that you've learned through trial and error, lots of pressure, lots of other sort of support elements to get you going on the bike.
Yeah, it sounds more like the latter. I have other recumbent bikes which are much easier to ride. The problem with that bike is my feet are clipped in and I have to get my feet 1 foot up 30 inches as I spin the first time. So even after riding that bike for 6 or 7 years, I typically crash starting once a year.
Oh.
Yep.
Thank you. Do we have another question on this side of the room?
Hello, I have a question for Dr. David Cadotte. I just had a question about the data set you used to find the markers of spine deterioration. Was that like a longitudinal data set? Where like you saw people over time get worse? And,
Yeah, thanks very much. So we have a couple longitudinal registries that we collect data on an ongoing basis. Some are local to our group in Calgary, and some are national data sets. Ours in Calgary are a little, they're more rich than the national data set because we're able to incorporate a lot of the imaging metrics, some of the MR data, as well as some advanced imaging protocols that looked at specific axonal tracts in the spinal cord or the amount of myelin that is present in the spinal cord. And we collect this every day of the week, and we have been since I started in 2017, and that data set continues to grow and will hopefully grow indefinitely. Our models get better the more data that we have. So yeah, thanks for the question.
And we have someone from the virtual audience.
Yes, someone online is wondering, and that question is probably for Dr. Swamy. Do you recommend cortisone injections for herniated disc pain?
That's a good question. So, in fact, this is part of our routine. When patients come in with what we call a hot disc or really acute sciatica, we generally arrange for injections for the nerve root that's affected. So if you're getting pain down into the top of your foot, often we'll call it L5 radicular pain, and we'll ask the radiologist to put a little bit of steroid and a little bit of freezing around that specific root that's inflamed. So those are called selective nerve root injections, and they work really well in patients who are having leg pain. Injections around discs are a little bit more of a thorny question. And usually the second most common injection is not around the disc, it's around the facet joints in the back. And again, they're extremely common in Alberta. They do help a lot of patients, but there's probably a ceiling effect. After a little while, it doesn't work as well. So I think to summarize, to answer your question, if it's a really bad, what we call radicular pain, a nerve pain, then the injections work very well.
On this side of the room, yes? I really feel like it really isn't. Let's just switch that one up. Thank you.
Thank you. Thank you all for this amazing presentation. I'm in information overload, which doesn't often take much, but it definitely is incredible. So thank you. My question for Dr. Swamy is when you were talking about resorbers and non-resorbers, is it possible for people to return to their previous activity after this discovery and treatment? You're talking about the 85%. Can they return to their activities after this has been addressed?
Thanks for the question. I think absolutely yes. For the most part, after a disc herniation and an episode of sciatica, most people who are resorbers, or even if they're non-resorbers, are able to return to their regular activities. Now, for example, some NHL level hockey players may have a disc herniation and get back to hockey. So that is possible. It may not be on the time schedule, as you had mentioned, that you would like, but it can happen. Now, there are some other people whom after a routine disc herniation, and this would be the minority of people, the majority can return to activities, the minority of people will have really bad back pain or other symptoms thereafter and may need more treatment.
So the SI or the sciatic issues that you're talking about, are you referring to that as well? Yeah. And SI issues?
SI issues are a bit misunderstood, I suppose. I'd say that they're much less common than disorders of what we'll call the mobile lumbar spine. SI, because you feel pain overlying the SI joints, many people say, oh, that's my SI joint. But more likely, it's coming from the mobile spine, which is located above, but the pain is felt lower down.
Interesting. Okay, thank you.
Maybe from the other side of the room or at the very back or anyone in the front? I'll go back over to here and then maybe Karen, let me know if we have someone on the virtual. Dr. Hutchinson. Good gracious. What is
This is the cardio
Okay.
part of the
That's
talk
right.
today.
It's all about movement.
This question, I guess, is mostly for Dr. Nichols. So now that the hip surgeons are doing more anterior approaches to the hip and that requires them to extend the leg down on the operating room table, have you folks been seeing more issues with the lumbar spine after those surgeries, like disc herniations or things come up?
No. So I would suggest that, there's a certain phenotype of people that get problems with their discs and do get disc herniations, and a certain phenotype of people that get arthritic change in their hips, and often there's a significant overlap between those two groups. What approach is used to, as you know, as you personally know, is used to put in a total hip arthroplasty can affect your recovery. It can affect muscle strength afterwards. It can affect mobility afterwards and recovery times. But ultimately, getting things in the right position is probably more important to us as spine surgeons than which approach you took to put those in.
One from the virtual audience. Thank you, Dr. Nichols.
Yes, this question is probably for everyone. Are there any formal programs in place to address pain and activity for those of us waiting to speak to a surgeon?
Oh, that's my question too. We'll start, can all three, well, we know your example. We'll start Dr. Nichols, and then any
Sure.
insight as well, Dr. McWay, about that?
I would suggest that Dr. McWay's program is rather informal and personally driven. There's a lot of research that goes into what a prehabilitation program should look like and how to standardize that across the country. And it's a subject that the three of us have already discussed at length. I think there's a lot of interested partners in the community as far as starting something like that, but we have yet to formalize a program like that. We're working on it.
I'd like to add that, again, Dr. McWay has told you a lot about how you can build your own program. And I'm not sure that there are formal programs that end up costing a lot of money out of pocket that are so much better than trying to move yourself. So that's easier said than done when you're in a lot of pain. So I think patients on our waiting list, every patient is not the same. And those who are in real agony, we do try, but perhaps aren't very successful in getting those patients seen a little bit earlier than other patients. And so perhaps if you're having a really tough time, reach out to your family doctor to make a phone call to one of us, and maybe we can see you earlier. And otherwise, there's a lot of people who can help you in the community, but you don't need to spend thousands of dollars.
Yeah, I don't have much to add. I think it's important to stay active, despite being pain. I know that's harder said than done, but I think one word that I tend to describe to patients in the clinic a lot is a word, kinesiophobia. People are afraid to move when they experience pain. Mm-hmm. So I try to explain that a little bit, and it's difficult to project on everyone's unique situation to answer that question, but I think the principle is try to stay as active as you can despite going through these experiences.
I'm sorry, that just so reminds me of my father, who had all these issues, and he'd just sit in his chair, and we'd say, "Dad, you have to get up and move." He said, "Lisa, you don't understand. I'm perfect just sitting here. I have no pain. Everything is good. No, Dad, get up." And he just wouldn't, right? So to speak to that point, do we have some more here in the front? Oh, at the very back, sorry. At the very back, yes. I'm just moving. Okay, sorry, if you don't mind. Yeah.
That's okay. I just, I want to thank the speakers as well. They were really wonderful presentations and very informative. My name is Dr. Rebecca, and I am a chiropractor, and I just wanted to throw out there that there is a research program currently developed in partnership with the University of Alberta, along with the University of Southern Denmark. And it's a group education and exercise rehab program for people with persistent or recurrent low back pain. And it's designed to provide education and exercise rehab to teach people how to self-manage their back pain. The University of Alberta collects data on these participants to further the research in low back pain management. And of course, not every intervention is appropriate for every individual, but there are some structured program options out there that may be appropriate for some people to explore. And if you have any more questions about the program, I am one of a handful of healthcare providers in Calgary certified to provide it. I have a booth out in the resource area, and I'd be happy to answer any questions.
Thank you. Thank you very much. On this side of the room, anyone before I come down in the front? Karen, anyone online? Let's try and squeeze in as many as we can in our allotted time.
I have a question here from Diana. She's wondering, she's in good health, but she also has a burst L1, severe osteo and debris pressing on her spinal cord. How can she find out if she is a resorbed or not, Dr. Swami?
The resorb. Yes.
Well, again, these are very specific questions. Again, the condition sounds, right now, I suppose, more broadly, we don't know yet, or that's what we're working on. And so for the specific question, I think it's best to reach out to one of us directly through the family doctor or referral pathway, and then if it's a really bad problem, then we can help her out.
Thank you. I know there was one here in the front here. We'll just grab it, get the microphone. Thank you. How are we for time? Couple more? A few more? Okay.
Hi, I was just going to say that I have heard of a program that is offered, I thought, by the University of Calgary called GLAD. And I was just wondering, and what I had heard also is I know some people who wanted to enroll in it, but there's never enough people signing up for it. And I believe it costs about $700.
It was 500 the last I saw. I know, just to speak to that I think you can also find it through some physio clinics. They too have the GLAD program. I know that I tried to access it at Westbrook, and it was $500 for group classes. Maybe one of the doctors could just maybe speak to that with the GLAD, or do you know,
I think
Dr.
actually the
Swami?
young lady who just gave us and has the booth.
Get this woman a mic, please. Thank you.
You're welcome. So yes, my name again is Dr. Rebecca. I am certified in the GLAD Back program. Like I mentioned, it's a group education and exercise rehab program designed for people with persistent or recurrent low back pain. It was developed in partnership with the University of Southern Denmark and the University of Alberta. It is a research program. They are continually collecting data on the participants to further the research out of UA for low back pain. I am one of 2 providers employed at the University of Calgary to provide the GLAD Back program, and I also provide it in my private practice, both virtually for any resident in Alberta, as well as in person. Again, I have a booth out in the resource area. Happy to answer any more questions about that. Just to clarify, I'm not certified in GLAD Hip and Knee OA, but I believe that's the program you're referring to in terms of payment price. GLAD Back is a little bit of a longer program in terms of number of weeks and number of sessions.
Okay.
So currently the price is $699 for the full program. Again, because I am a chiropractor who teaches the program, it is eligible for chiropractic extended healthcare benefits, healthcare spending accounts, and income tax receipts for healthcare expenses. And if you're a senior 65 plus, Alberta Blue Cross in Alberta does provide some coverage for chiropractic care for seniors. So again, I don't want to take up too much time, but if you have any questions or further information, please find me out in the resource booth. I'm happy to answer any questions you guys may have.
Thank you. Thank you so much. I think we're okay for a couple more then. Yep, okay, I'm getting the nod. So any other, here we have one over on the side. Oh, okay. Yep, thank you.
Thank you so much. Amazing presentation. I have quite a few spinal issues, and before I'm looking into spinal surgery, I'm looking into a couple things. One is radio frequency ablation, which I'm holding off on, and I don't know if anyone can speak to the platelet-rich plasma. I was looking into that as well for pain management. I don't know if that's anyone's expertise at all.
I don't know if it's anyone's expertise at all.
I know, it's so new.
In the world. Again, I would suggest that, most treatments that are really effective, the province will pay for. And so when people are trying to tell you that, I'm not talking about GLAD Back and exercise programs, but when people are trying to tell you that there's this intervention and that intervention that will cost you, and that you should do it, I would say think again. We've all had to evaluate all these treatments and decide at some point or the other whether they're effective for the members of our province or not. And something like this, we have looked at, I have looked at, and really the evidence base is really poor.
Is there enough has there been enough research on these, or?
I would actually suggest, and anybody that's come through my clinic will have heard it, that if the cause of your back pain is the weight of your wallet, there are a lot of people out there that can help you with that.
Can we quote you on that? We've got to remember that one, don't we?
Super, thank you.
Thank you. Anyone else from our in-house audience? Oh, there's one right behind you. Right, thank you.
Hi. I was referred to the GLAD program because I'm having knee replacement surgery. If your family doctor is part of the primary care network, you can often get the GLAD program for free.
Okay, good to know.
Check into that, that's a possibility. But my trainer at my gym told me all the stuff that I was doing at the gym was actually better than the GLAD program, so there was no need for me to do that. So it's kind of like what Dr. McQuay said, you have to look out for yourself, you have to do what's best for yourself. And I have tried the PRP for $780 and it didn't work.
Can I just add a comment to that? We're getting to have more and more programs, and this is an area we're starting to understand how important movement is, which is fantastic, but it's a relatively new thing. So the group programs are excellent, but at the end of the day, it kind of falls with yourself. And if you're exercising when you're beat up and in pain, it doesn't really work to go with other people. You have to do a lot of it on your own. You have to learn to go out and ride a bike on your own, do yoga on your own. That's just the way it is. I mean, it's great when you can do it with your buddies in the group, but in this setting, you'll have to do some of it alone.
Any more questions from, you have one more here, I think, in our, oh, we have one at the back too, okay.
Can you speak to the role that diet, nutrition, and inflammation have when it comes to joint pain?
No.
That might have been last year's. But the good news is you can, the doctors that we actually had last year did speak to that. In fact, I think even we actually had a nutritionist in 2022 that also spoke to that very subject. So you can actually access that on the McCaig Institute website or on YouTube and just punch those in, you'll see the links.
I suspect that the effect size of all those kind of interventions are probably pretty low when you look at the diseases that we deal with. Not to say they shouldn't.
Mm-hmm. Okay, a couple more. I think we have time for 2 more. Anyone online, Karen? Just, no, okay. 2 more then, thank you. Yes.
Thank you. I am Luz. Aside from the exercises needed for these spinal pains or whatever, are there other advices or precautionary measures or practices to employ in order to avoid the progression of these spinal disorders or illnesses? And or if ever it occurs, to prevent spinal cancer?
Preventative measures.
I think if we knew a foolproof, definitive, preventative measure, we would be relaxing on a beach somewhere right now. Like, I don't think anybody really knows that. There's obviously things that you can avoid. I would suggest to everybody here that you not start smoking.
Mm-hmm.
It's,
Mm-hmm. Dr. Swamy, anything you'd like to add to that?
I think it's unfortunately a question to which The answer is no, that we don't. That first of all of our spines are a little bit different one from another. That some of us get spinal diseases early, some of us get it much later in life, some of us get it more severely, some of us may have very severe biological disease or structural disease, but don't have any symptoms, and vice versa. So I doubt very much that there'll be one prescription for all of mankind for a spinal disease. I think there are probably a group of heterogeneous diseases, but that's a very long way of saying, no, we don't have anything yet.
But they are working on it, right? Thank you so much for the Q&A panel. Thank you for your questions. Thank you very much. They're working on it, but I know we all want that magic bullet. I understand. Frankly, I'm quite annoyed that somehow I have osteoarthritis in my hip. Like I've been active my whole life. I always exercise, and now I can't even walk to the parkade that well. So we'll see. If I'm back next year, you'll see where I'm at next year. Hopefully I'm going to be, I know I'm already inspired by Dr. McWay, and so I hope that I can continue his journey and follow his example to continuously work on my individual health plan, so to speak. Now, in celebration of our 30th anniversary, I'm delighted to invite Marilyn McCaig to the stage. Marilyn has a longstanding commitment to volunteering in Calgary, and together with her husband, Jeff, they support various programs through their personal foundation where she is chair. Marilyn.
Thank you, Lisa. I am very pleased to have the privilege of giving a few closing remarks, and they will be brief. As we heard, this is a special day in the history of the Wood Forum at the McKeag Institute. 30 years is very special. Ron Zernicki spoke so eloquently this morning about John and Chris Wood that I will not go into that. But I would like to speak about their daughter, Donna. We are so fortunate that Donna Wood found this a worthy endeavor, and she has continued to support and design the program that you saw delivered today. Donna puts a lot of time and energy into choosing a topic that will resonate with a wide audience. Over the years, she has been very involved in the selection of speakers. She has often brought us Olympic athletes, professional hockey, soccer, excuse me, and football players that had first-hand experience in how injuries impacted their life. Herself, she is an avid sportswoman and a huge sports fan. In fact, she is probably the biggest sports fan I have ever met. If there's a game, she is at it, and she is probably wearing a wildly colorful wig. She is also the person cheering louder than anyone else. She roots for beloved Flames, Stampeders, and the Cavalry. Her passion and energy are inspirational in all she does. I am so honored that on this 30th anniversary, I am going to announce that Donna, special to me too, and the Wood-Krausert families have made an impactful donation to the Wood Joint Fund. It is their desire to see this event be offered even more frequently and to grow into a larger event. Their donation guarantees this continuance into the future. It's because of their generosity that we will continue to hear about MSK Health and to hear from specialists in the field. This is a huge gift to public education, which doesn't always get attention, and it will help us be better informed, be better advocates for our own health, and perhaps even be a little less creaky, Lisa. So thank you, Wood-Krausert families. We are very appreciative. And next year, we will have another forum. Look for us in November, and we will continue to address our health and mobility. Thank you.
Bravo. Bravo. Marilyn, yes. Bravo. So we're now near the conclusion of our event. Marilyn is here with me because we would love to show you, as a token of our gratitude for your continued support today and over the past 30 years. This is why we are here with these wonderful door prizes. So again, you must be present to win. And if you do win, please just put your hand up and so we know where you are, and then please come to the stage at the end of the event. So we will begin with the dinner for two at Sky 360 at the top of the Calgary Tower. Here we go. Drum roll, please. Oh, lovely, yes. And here we go, and it is Brian Thomas. Are you here? There he is. Congratulations, Brian. You're the next contestant on, oh, okay. Next up is the Spruce Meadows Long Table Afternoon High Tea. So this is going on at the International Market coming up. I actually will be there on the Saturdays with my children's series. So if you see me, come and pop by. Here we go. The first winner is Marina Lau. Marina, are you here? There she is, yay. Enjoy your tea. Yeah, and just come down at the end of the event for us to get your particulars. And now the final draw for the Long Table Afternoon High Tea. The winner is, Constantine? Yeah, okay. Well, congratulations to our winners. Thank you so much, and so just come down to the stage, enjoy your tea, enjoy your dinner at the Sky 360, and a final big thank you to Dr. Donna Wood, her family, and the Wood Joint Research Fund for enabling us to continue these valuable public events. We're almost there, we're almost there. I think we need to also give a big round of applause, please, for our amazing speakers who have joined us here on Saturday. This event is also supported by the Alumni All Access Partnership Fund. And if you would like more content from the McCaig Institute, please stay in touch with them on social media. They are on X, on Facebook, YouTube, and Instagram. You will receive an online survey in the next few days about the event, and please do provide your feedback because it really helps us when we plan for the next events. Thank you again for coming today. Please mark your calendars. Guess when the next Wood Forum event is? Saturday, November 8th, 2025. To good health, my friends, to good health. Thank you.